Okay, meeting for January 10th, 2025, 9 a.m. to begin. First up, Happy New Year, everybody.
Happy
Glad
New
to see you. Happy New Year. Off to a good year.
Here.
Let's hope we're off to a good year. Do we want to do anything about the minutes? I didn't see anything, for reviewing minutes and approving the minutes.
Yep, under administrative.
I see office elections. Okay,
Yep.
so we're gonna do, so I guess we'll do, elections first. Anybody got anybody's
I
thoughts?
put a motion on the floor to nominate Diane Romeo as chair again. I know one of the
That was
reasons,
all.
why I'm nominating Diane is, I know we just, can people hear me?
Yeah.
We decided as a group to start elections in January.
Yep.
And we're committing to that, but Diane and Brandy didn't do a full term yet, so I'm gonna put that motion on the table to nominate Diane as chair, fresh in January to complete a full term.
Thank you, Jim.
I would second that motion.
All those in favor?
I.
We'll have to do a roll call
Yep.
vote.
Okay.
So Jane Smith from Alford, aye.
Oh, I
Jim
can't.
Stockbridge, aye.
Lennox, aye.
Sheffield, I.
Mount Washington,
All right.
Ellie,
And-
you're representing Lee.
I'm Lee. Okay, I get switched around.
Okay.
Utility
Unanimous.
player.
They're always the most valuable.
Yes.
I thought there was someone waiting.
Oh. Just a
Oh,
second.
just iPhone. Okay, so never mind.
We all set?
Yes, there's just someone on an iPhone and we just want to make sure that we know that, how to count you. Would you like to identify yourself?
Ask to unmute. Okay.
Hi, sorry, I'm trying to unmute. I had to log in from my phone. It's Rania.
Oh, hi, Rania. Okay, perfect. Thank you.
I'm sorry.
All right, perfect, Rania, which we'll get into later.
That's right.
All right.
All right, so now we'll go over to approval of the minutes. We have
Yep.
two set of minutes.
Diane, we got to nominate a vice chair.
Oh, I thought you said two. Okay, I thought you said, when you mentioned that both Brandy and I hadn't done a full.
Yes,
Well,
yes.
I would like to nominate Brandy Page as the.
I'll
vice chair.
second that. And a roll call again.
Jim
James-
Stockbridge, yes.
Jane,
Jane, yeah, Alford, yes.
Lennox, yes.
Sheffield, yes.
Margot, yes.
Mount Washington, yes.
Lee, yes.
Okay,
Okay.
I thought we were a package deal. That's why I went
No,
over that.
You are now.
Okay. So now we'll look at the minutes. There's two sets of minutes that I know Jane sent out earlier on. Anybody has any thoughts about them?
I move to accept the minutes of July 12th and October 18th.
Oh, thank you.
I'll
I
second.
that.
Okay, all those in favor? Oh, Jane is writing away.
Yep.
All those in favor? Aye. Okay,
Any
Yes.
abstain?
Do we need to do a roll call?
I don't think so for
Yes.
this.
Just for
It would
the,
be best, yeah.
you do
Okay.
because we're online.
Yep. So Jane Smith, Alford, yes.
Lennox, yes.
Sheffield, yes.
Stockbridge, yes.
Mount
Lee,
Washington,
yes.
Okay, perfect.
If it wasn't online, would we have to do?
No.
No,
Just if it's online. Okay.
yeah, yeah.
Okay. New mailing address, everybody's seen that? So that's. Okay,
You guys will have, well, Jim, don't you think it would be a good idea to have like a open house or something like in February, the beginning of February or something?
Yeah, well,
Mm.
I'll send something out on that. So just what the chair Romeo is referring to is the Tri-Town offices have finalized our move from Lee to the town of Stockbridge. the 50 Main Street, Stockbridge, Mass, Stockbridge Town Offices. I did send out a press release, but the PO box is 307 Stockbridge, Mass, for those that want to go back and watch this show when it's done on CTSB. I did send out a press release, and I am going on a radio show next Friday just to talk about the move.
Oh, wow.
The collaborative staff, with the exception of Jason, will be on the ground floor where the old Council on Aging Director's offices. We'll be adjusting those signs as soon as we can, and the remaining staff will be on the first floor. My office, the inspectors, the tobacco program, and Jason's up there as well. But yeah, so that's basically it.
Nice surroundings finally. Yeah, long overdue. Very happy that that's happening. All right, quarterly report. And it is.
Yeah, so this is just our normal, presentation. I would please note, like, so we are including the 3 months that of the quarter that we're in. And then next month, we're just reporting it quarterly. That way you get a snapshot of what just happened, but we're not having to take up pages and pages. And it fits on the page. So Jill, do you want to talk about some of the trends that you're seeing?
Flu is ramping up across all ages. Norovirus, what's getting reported like through hospitals and doctors' offices is mostly older people. We don't get reports on RSV or mycoplasma pneumonia, which has been talked about in the news. COVID's here, but it's only what's being reported in the hospitals or doctor's offices. So it's not a true snapshot of what's out there, but it's out there. It hasn't gone away. I mean, I expect it to get a lot worse in the coming months. So we'll see.
What do we know about, or would you get notified of this new virus that they're talking about? That's in China right now, and it's in Europe, and then it's starting in the United States.
Which one?
Are all of them, I guess?
Which one?
Yeah, I
Okay.
don't know. I have no idea.
Okay.
And then we see a lot of Campylobacter, which is foodborne. That's a big one so I don't know why, but we're seeing a lot of that. And people have been admitted to the hospital for it. They've been that sick. So yeah.
Jane, I don't have questions on the quarterly report per se, but I know Dr. Blagg is here, and we did have a lively tri-town meeting a few weeks or so ago, and H5N1 is definitely on our radar screens, and we're going to be continuing to talk about that. We did see a human case. I can't remember if it was California, but Dr. Blagg, I don't want to put you on the spot, but if there's anything you wanted to mention about that, and my follow-up question possibly would be to Jill at some point is, I assume H5N1 in a human case would be a reportable.
Oh,
I'm
yes.
sure I will be contacted by DPH directly, either email, phone call. I will hear from them.
Yeah.
I'm sorry, to my knowledge, I frankly haven't looked at the issue for the last 2 or 3 weeks. Is it so thus far there is only one reported case of a serious illness in a human from H5N1, and that was in Louisiana. It was a man who developed severe respiratory tract symptoms. A similar case was reported in, I believe, British Columbia. What was unique about these 2 cases is that it appears to be a different strain than the strain that has been causing the dairy infections and the chickens. So it's something to be concerned about, to be monitored closely. I think we had discussed about getting some additional information from the agricultural folks in terms of what they're doing to monitor herds
Yeah.
of cattle. But other than that, I have nothing to add.
Yeah. And I'll briefly say that I'm working with Dr. Kenny on, newly elected third Berkshire District State Rep Lee Davis is working on, legislation to create an advisory council for H5N1, and I've offered, my services to be on that council. We'll see how that goes.
Hmm. Thank you, Jim. Anything else on you want to say anything else, Jill, about anything?
Well, I
Quarterly?
have my whole update.
You have no, she's next.
I think that's about it.
Jim, if I may ask, the council that is being discussed, is this to supplant, augment, replace the activities of the DPH?
It hasn't even been filed yet. No, I would recommend connecting with Charlie. He's working directly with Lee on that, and we should probably have a conversation offline to see where it goes.
So while Jill here's up, the last page of it is as of today, the vaccine report, so.
Okay.
Like that.
Significant increase from last year, especially the in-home vaccines. I think last year was 27, this year with 63 people. That includes any caretaker, spouses, other family members that are in the house to take care of that.
Nice.
A lot of 5 to, this year we offered 6 months to 4 years and 5 to 11 for years for COVID. 5 to 11-year-olds, we had 111 kids that their COVID vaccines this year, and a lot of littles that got their first dose of COVID vaccine, so it was good to see that. I did send out letters to those families that their child needed a second and third dose. I've had one parent. So I don't know if they've gone elsewhere to CHP or somewhere else to get there.
But you sent
I did send
notification
letters
out, so
yeah.
yeah.
Yeah, explain
Good
this
covered.
is, these are the weeks after each one that, you need to follow up to get that done. Flu for state supplied flu for 6 months to 18, I think. At least 100 doses more this year than last year. And then we also had reached out, or East Mountain Medical have reached out to us because they're so short staffed, they were not able to provide flu and COVID in the office. So I did 2 clinics there. Around 80, 90 people altogether between the 2 days that I went there. So I'll probably reach out to Adrian Conklin. We start planning for this upcoming clinic season to see if they want us to, offer dates again. So that way we can just include them in the mix.
Do you think you offered enough in a variety of places? Do you think we covered?
100%.
Do you think we did too much? I mean, could we combine them and not have as many? I'm just trying to think of your
Yeah.
workload. It's just something to think about.
Yeah, because we cut it back by 4, I think, this year.
Yeah.
And like this clinic that's coming up tomorrow, we've put it out on
I
newspaper,
know.
we
Everywhere.
everywhere, and we'll probably end up with 40 people. And so
we
I'm
should
not
up that.
sure that for next year, it might be a better strategy to really for CHP and really in January, really push for people who weren't able to get it, who needed Saturday hours. Maybe we could work with CHP to see if they'd offer a Saturday, because that's the problem, is that people that work 9 to 5 can't come during the day, so.
And maybe advertise more offers too. Maybe offer some Saturday hours if, people call and we can't get to them.
I know when we did the Lennox one and we were into the 6 o'clock and a little thereafter, it was a little up around that time as people were getting out of work and they could run down and get it,
Well,
so.
now that we have a nicer office that's easier to find,
Mhm.
we might be able to maybe
Ah,
have some evening hours and
Right.
just have that into the schedule, I don't know,
Yeah.
on Wednesdays,
Yeah.
6 to 7, you can come in, or whatever it
Yeah,
is.
yeah, exactly.
Although it's a
Then you're
little
not
spooky down
dragging
there,
all your stuff all over. the
Yeah.
Right, exactly.
right there,
Yeah,
yeah.
yeah.
We did do CTSB for the first time this time as well, like called and had that on, so.
It's a work in progress, but
It's
it's
a work in
wonderful.
progress, we're improving every year.
Yes.
We're getting more efficient, so
That's
I
all you-
think that we definitely could, maybe have 1 or 2 less clinics, I don't know what that looks like, but,
Mhm.
yeah.
Before we go off of this, we're gonna be putting together our final clinic schedule. So here's some questions I have for the towns. One is, are you more interested in the clinic summaries is how many people came to your town's clinics? So that's one data point, and it has people from all over coming like to the Alford Clinic, The second and the third column are residents who got the vaccine, which takes, you can imagine, takes some time and,
Oh, wow. Okay.
and so, and then I'd like to do like a year over year to kind of show the growth over time. The towns, what are you most interested in? Are you interested in the people coming to the clinics? Are you interested in how many residents came to the clinics as a whole? Or do you want both?
I know the town's administration in Sheffield would like to know the number of residents.
Yeah.
The heck with the rest of the world.
Yeah.
Pardon me. But I think it's important to understand that we're part of an integrated system and that just as our residents can go elsewhere, people can come to Sheffield for their clinic. So I think it's really important to keep all of the data and not just segregate, to keep it and show both of those.
So is it confusing with the clinic summary? Is it clear to you guys that in its own little thing that's the clinics total? Because if you add across, it's not gonna add up to that. Is it clear in the way that it's presented now that that's what we're talking about in each column?
So what you're saying is that the white column on the far left for Sheffield, the 215, are the total number of people who
Came to the clinic,
came to the clinic regardless of their
right?
residency.
Residency.
And then the next 2 boxes are broken down for just the
Sheffield.
Sheffield residents.
Yeah.
I
Okay,
Yeah, I think there's value in what Pat said because, like, for example, towns are paying in to us, right, to help purchase vaccines. And, for example, Sheffield gives X dollars to contribute towards the purchase of vaccines, like all the other towns do. And so they're meeting the needs for their residents. But other people need to understand that Sheffield residents may go to Great Barrington and go to other places. So it's as we integrate more public health systems across the board, there needs to be, and not saying that there needs to be this level of recognition that there's no border in public health because if you don't do any clinics in Sheffield and Sheffield doesn't want to pay in, the Sheffield residents are now going to be burdened to go to another town that's going to take that burden on, and vice versa. So there needs to be this kind of like conversation about this is the same thing with everything else that we do in public health. You may do
Right.
septic systems in Sheffield, but like at some point it's going to affect other communities and stuff. And my other question on the vaccines, and you don't shortchange yourselves because you only have a handful of people coming to a clinic. The team did outstanding this year when you look at the number of vaccines. And I'm always kind of on Jane and Jill about efficiency because it's really hard going from day to day to day, packing up, transportation. Running a clinic is not easy, and especially the small ones over time takes a lot. It takes a toll on Jill and Jane. And Jason and everyone else that participates and volunteers with the clinics. I did have someone come up to me with all the respiratory illness stuff going on. Can someone remind me the challenges of not administering RSV, Jill, Jane? Was it an insurance thing? Because someone came to my office yesterday asking for the RSV.
Right, so our billing company is not able to bill because it's Medicare Part D. So it doesn't right now fall under the we can't bill that because it's a pharmacy benefit. So we just refer people to a pharmacy and we could help, you know, make that a point for them at any pharmacy.
Okay,
I don't think that, and it's very expensive.
yeah,
Maybe someday down the road, we're able to bill for it, we could offer it, but as of right now, they have to go to the pharmacy. Same thing for pneumonia. That's something we could offer and bill for, whether we wanna add that on.
okay.
I'm just curious if we have any stats on the overall volume of population in Berkshire County that has gotten vaccinated somewhere.
So there is, the state actually has a vaccination or a respiratory page, and it does go through all of that, and it per town. Towns like Mount Washington and New Marlboro and some of the other towns like Alfred that share zip codes. It's not as accurate as you would want. Although we have been, when we register people, we're really trying to get people's street address and put the actual town that they live in to make that a little bit more. And you'll see that like Mount Washington numbers went way up from last year. Probably the same amount of people or similar amount of people, but we were better at identifying Mount Washington people from those South Egremont addresses. Yeah. So, sorry, Jill, didn't mean to interrupt your whole report.
That's great. So tomorrow there is a clinic at St. Anne's Church in Lennox from 12:30 to 3:30. We have plenty of vaccines, so we are accepting walk-ins if people are not pre-registered. Going along with vaccine, I was contacted by the middle school nurse at Du Bois that they have to, every year they have to do an immunization survey for the state. So she ran her report and there are numerous students that need Tdap and meningococcal vaccine. And also it showed that kids were not vaccinated. Well, if they're McEnany patients, and I found this out with my own daughter, they have switched electronic health records a number of years back, and that information was not transmitted to MIS.
Oh.
So their vaccine records are correct at the doctor's office, but they're not in MIS, because I needed her vaccine record. I'm just gonna go to MIS and print it up. She needs it because she's gonna work at camp. So I called McEnany, I'm like, what is the deal? So, and they explained the whole thing. So there's that piece. So it looks like if you run a report for kids like whatever age range, there is a large population of kids in South County that looks like they are not vaccinated or they are under vaccinated because they go to McEnany and this is what happened.
Oh, wow.
So
You hope that's the explanation.
yeah, that is the explanation.
Yeah.
That is the explanation, because when I went into the nurse's offices and I manually inputted all that vaccination record into MIS, so it shows that
wow.
they have it. Like doctor's offices are supposed to be doing that. Like when they get a new, either they get a kid transferred to their office, or if they have a newly arrived person in their office, patient, they're supposed to be entering that information. It's supposed to go to MIS, and it's not happening. So that was a lot of work to get that done, to see who's missing what.
Oh.
So I have a clinic scheduled for next Thursday at Du Bois and Friday at Monument. I sent out letters to the parents. I got permission from Peter Dillon to host these clinics at school during school hours, because we know it's hard to get an appointment, hard to take time off, miss hours at work and pay.
Yeah.
So we are offering hepatitis A, hepatitis B, meningococcal, Tdap, polio, MMR
Wow.
as of right now. Those are the vaccines that were identified that those kids need. Those are school required vaccines.
So is the school gonna help be sure those kids come to that clinic?
So the middle school nurse is sending a direct message through Power School to the parents, reminding them, like, this is a great opportunity, you know, she's got if you want to take advantage of this, you can. If not, you know, you can go to the pediatrician's office and have it done.
But you will be required to do it. Yes?
They're supposed to, like, kids going on to college, they don't have their second meningococcal vaccine, that's, you know, they'll
Some
have to get it at
colleges
some
aren't
point,
taking
but
them
it's
in.
an opportunity for them to be up to date.
Is this the only school that's got an issue? Mount Everett
I'm
doesn't
sure-
have it?
You know, I haven't heard from the
Leonard?
schools. I am gonna reach out to the other
Okay.
schools and see, you know, get through this one first.
Okay.
Yeah, no, yeah, it's gonna be all, it's a big project.
It's,
So. And I don't wanna order a ton of vaccine and then have it expire and then that's on us.
Yeah.
So. Yeah, so that's where I'm at with that. But
That's
let's see.
still
I'm
tricky.
hoping,
is it,
I'm hoping.
it's still tricky with, ordering the vaccine, I imagine.
No, I had
No?
Dr. Penny's understanding orders, and once I had those, I put the order in through the state. It's
Okay,
easy, it's just like ordering flu and COVID.
okay.
So yeah, I just don't want to over order. So yeah, hopefully we'll get a number of parents that wanna take advantage of
Oh,
that.
nice job, Jill.
Yeah. Yeah.
Oh,
Matter of balance, that, heard an update from Isaac that their new coach had been out on a medical leave and just returned. So once she's back up and running, they got a class and we'll get that, hopefully get that going. And then on the next page of the packet here is the updated wellness sessions.
mhm.
Rich, Pam and I had gone to each of the towns, to try to figure out a date and a time that is gonna work. It seems like Tuesday is a hot day for a lot of activity going on at the senior center, whether there's lunch, bingo, something else. So a pretty jam-packed month. So we'll see how it goes. Went to Sheffield the first Friday. That was a pretty good turnout, considering they're interested in the handouts I was giving them for the education topic is thyroid, but you know, that's all right. And had a meet and greet with the Stockbridge, Senior Center on Tuesday, just because we're new there. It was bingo day. They're
Perfect.
a hoot there.
They're a hoot.
They're so happy to have us. Same
Yeah.
thing with Tyringham. We met with them. They're excited we're gonna come. So that's like where all the gossip is.
Good.
So yeah, that's, and then you'll see the list of the monthly topics. October and November are dependent on the clinic schedule,
Mhm.
so hopefully. And then I'm gonna be out on medical leave in March. Actually, this month for a week and then in March. So Denise, who was our per diem nurse that recently retired from BHS, she's gonna cover all of these wellness session dates.
Oh, good.
And then Stephanie Adler's gonna cover Maven for me while I'm out. So it's good to have some backup. Yeah. That's.
Right.
Any questions?
An ambitious schedule, thank you.
I think you should do hand washing in a month that isn't so dry skin time anyway.
Yeah, but that's when norovirus is.
They can
kicking up.
do it
That's
every
right.
month.
Yeah, that's what we were thinking.
Oh,
Norovirus, hand wash, and that's the thing people forget, like, we hand wash during COVID, but when I go to a restaurant, I'm like, I need to go wash my hands before I eat.
Right.
So, yeah. Yeah.
all right. Staff updates.
So, Jim, do you wanna?
Sure, yeah. So, as you recall, Pam Stout, who was our equity access coordinator, is no longer with us. And it was a budgeted part-time position. We were trying to make it work full-time, but with her exit, we've re-strategized and moved that money into the inspector line item, since one of the top priorities is workforce performance standards for inspections. As Jason takes on more town, and Jane was kind of during the transition with Jason coming on full time, Jane was taking a lot of that on, and as she's transitioning that to Jason, he's picking up a lot of that legwork. And we need some help for Jason as well as backup in case he goes out, or when he slips on the ice or something. And Jane, I don't want to put Jordan on the spot, but like we're Jordan's been helping. I think Jane and Jason with some Sheffield stuff, and I think there's an opportunity to kind of build some capacity with Jordan, which we'll talk later on, but we've kind of put that limited funding back into the inspector line item because, you know, Jason can't be at this two different places at the same time. And, you know, there's an emergency perk in this town and there's a housing issue in that town and there's a food inspection over here or complaints over there. You know, it is part of our long-term sustainability plan to build capacity. So that's sort of like where we're at.
Okay.
And then looping back the town budgets and contracts, so the budgets for fiscal year 26. At this point, I've reached out to every town, and so they're going through their own process. And so we'll pull together contracts, and it's a good time because we're doing the public health nursing contracts with the new amount. That's when I think getting the set fee schedule, which I had started, but I didn't want to put it out until like it looked nice. So that would go to the towns along with kind of a summary page of, you know, what each one includes and whatnot. So that will be on the agenda for the next week. In the meantime, you know, this is budget season, so this is the time similar to what we talked about and voted on last month. And then the other thing, and I think one of our guest speakers, Kayla, who is on, is going to talk about some of the other types of things that are coming up. So like the foundational public health services, there's going to be notification to the towns of another process, and I'll let her talk about that. So there's going to be some communication from the state directly to the towns around what the state is kind of doing in public health, and we want to make sure that it doesn't catch anyone off guard.
Okay.
So I'm just kind of giving you a little bit of a heads up on that.
When they say talk to the towns, do you mean the boards of health or the administration?
So town manager, town accountant, the chairman of the chairperson of the select board, and the boards of health. So they've asked for that information. I will be giving it to them next week. And so, and then after that, I think it's going to be a written letter, but I'm not sure. So again, I want to just make it so that when they get the letter, they're not like, what is this about? Now, I had already sent out about 3 months ago, I sent out a letter to everybody, that same group, talking about like what, you know, giving them notice that they are part of this program. And so that's already happened. So most of these people should already kind of know like who we are at this point. But that's part of our work in the collaborative, is making sure that we're getting more visibility and people aren't asking, who are you again? So.
Yeah. And Jane, before Kyla starts, I want to just echo what your quick summary was on our constant communication. I mean, we put out a lot of communication, whether it's our collaborative meetings, we record all our meetings, minutes, websites, notifications. I'd be surprised, unless there's like a special election on a board of health or wherever, or interim town manager, like we know Mark left and Chris has taken over Great Barrington. There should not be any confusion on what PHE is and what the things that we're offering our towns. And if there is, it's not because of a lack of communication from this collaborative board and staff. It's just, you know, maybe sometimes people don't read mail, who knows, but the amount of effort that goes into communication since the beginning, I think we're doing a pretty good job of that.
Thank you, John. All right, that's all I have.
Okay. Do we want to introduce Kayla and have her start?
Yes, that would be great.
Welcome, Kayla.
And can you say your name so that we're saying it right?
Yeah,
Is
it's
it Kyla?
Kyla, but yeah, that's okay, no worries. Yeah, Kyla. Thank you all so much for having me. I think I sent a request to be able to share my screen.
You're good.
Perfect. So I just have some short slides to share with you all. my name is Kyla Botzian. I'm an associate public health consultant with BME Strategies. And so BME Strategies is working with the Office of Local and Regional Health to implement this foundational public health services shared services review that is officially launching with all of the shared service arrangements across the state next Tuesday. And there will be an introductory meeting that I'll talk more about in just a second. So jumping in, can you all see my screen?
Mhm.
Okay, awesome. I'll talk about what the Foundational Public Health Services Framework is really briefly, and then what the review will look like. I'll show you a snippet of the timeline for the review and then talk about next steps. So the Foundational Public Health Services Framework defines a minimum set of public health services that should be available in every municipality. And local public health isn't responsible for delivering all of these services, but they're responsible for providing connections to these services, whether it's through external organizations or providing them themselves. And it was developed by the Public Health Accreditation Board and has been adopted by several states across the country. So this framework is made up of 5 foundational areas that are shown in the circles. These include communicable disease control, chronic disease and injury prevention, environmental public health, maternal, child, and family health, and access to and linkage with clinical care. And then there are 8 cross-cutting foundational capabilities that are shown in the dark blue rectangles. And these include assessment and surveillance, community partnership development, equity, organizational competencies, policy development and support, accountability and performance management, emergency preparedness and response, and communications. So the Foundational Public Health Services Shared Services Review is a data collection and planning process that works to document existing resources and services that Massachusetts local public health offers. So this is going to be done by utilizing 2 data collection tools. The first is the cost tool, which collects information on the resources that each local public health entity is spending on activities related to the foundational public health services. And the second data collection tool is the service delivery tool, which will work to capture current services provided, as well as services shared throughout your SSA and with other external partners, and the overall capacity and staff expertise that you all have to fulfill the foundational public health services. So the cost tool is a spreadsheet that will be based in SharePoint, and each local public health entity in your shared service arrangement will have their own cost tool. So you'll be reporting on your individual municipality's spending data for the fiscal year 2024. And in the tool, there will be 6 data entry tabs where you'll input information about your revenue, staff costs, seasonal staff and interns if you have them, totally okay if you don't. Any hourly rate contractors that you may have, and then you'll indicate any other spending that you have, and then you'll allocate all of this spending according to the foundational public health services. And I know this seems super crazy now and like broad and not super descriptive, but this is just a general overview, and we'll go into more details in upcoming webinars in the month of January. And also I'll be available to meet with you at any point to answer additional questions. So the second tool is the service delivery tool, which is also an Excel spreadsheet that will be based in SharePoint. The difference for this tool is that there's one tool for the whole shared service arrangement, and each municipality in the SSA will have their own tab in the tool where they'll answer their own set of questions. And then there will be a tab for the shared service arrangement, which will be completed by the shared service coordinator and completed on behalf of the shared staff. And then there will be a summary tab at the end of the tool that compiles all of your data so you're able to see how the data compares between municipalities in your SSA and use that for future planning. And the questions in the service delivery tool will record your current ability to provide the services that are outlined in the Foundational Public Health Services Framework.
Are there negative options?
Yeah, we'll get into that later on in the review period, but something that made me think is it's not it's not a punitive thing. So I know a lot of people are scarred from the cart that went out last year and felt like they were getting like graded on their responses. That's not the intention of the FPHS review. The intention is really just to capture your current ability to deliver these services. And so it's totally okay if you're not currently delivering the services as you complete the service delivery tool. We expect that most of Massachusetts local public health is not delivering the majority of the services, but this is just a way for us to document that, which then can be used for future advocacy and planning to support local public health more in the future. So who will complete the tools? You all kind of spoke about this, but so it will be, this is just some examples. So if this isn't what it will look like in your SSA, that's totally okay. But for the cost tool, it will really be whoever manages each municipality's budget. So if you have an accountant, it might be that person. If the health director manages the budget, it will likely be them. Or if there's someone who knows a lot about the budget, they could be the person who completes the cost tool. So if this describes you, I'd love to collect your contact information so I'm able to give you access to the tools when they're available in SharePoint. So the tools will be made available on Tuesday of next week. And we have to individually type everyone's email and like provide them access to the specific tools for their municipality. So if you think that you'll be the person filling out the cost tool for any of the municipalities in your SSA, please scan the QR code and provide your email for me. And I'll be contacting your shared service coordinator as well throughout. So if anyone doesn't know right now, that's okay, and we can determine that later. And then
And is it accurate to say, Kayla, that you need to have a Google Drive in order to fill this out?
The survey or the tool?
The QR code, does someone have to have a Google account?
Oh,
in
no,
order to? Okay,
they don't. I don't think so. Is it not working?
it is, but okay, go ahead.
Can I also ask a question? While I would not be considered the person who controls the budget for the Board of Health in my town, it may be filled out by the town accountant, but I certainly would want to know how that person had done that, how they had allocated stuff, because they really don't know what we do.
I think it would be you, Pat, in this case, because you're the one that like presents the budget to the Board of Health. Because Sheffield doesn't even have a town accountant. They use a third-party vendor.
Well,
So
they do now, yeah, that's right.
yeah, so
Okay.
Yeah.
we'll
I mean, I just
figure
to
it out.
check on these, in a case where it really was done by someone outside of the Board of Health or the health agent. I mean, there should be some coordination there to be sure that they're in sync and agreement.
Yeah, totally. And it also could be like if someone outside of the health department is filling out the information about the actual spending, it could be one of you all that does the allocations to the foundational public health services, because you likely know more about that. So you can kind of work in tandem to complete the tool, if that makes sense. Also, it's only collecting information about the local public health department. So we're not collecting information on other folks that may be employed by the town. It's just the health department.
That actually leads me to a question I have, if I can interrupt. You mentioned that the health department doesn't necessarily need to provide all these services. We just have to link folks to these services. Are there options in this survey to include those organizations who are providing X service? Like you said, this is just for the health department, but in our region, we're really lucky that we have a lot of organizations who do this supplemental public health work.
Yeah, absolutely. There is an option. So if you think that you'll be someone who's completing the service delivery tool, which is next, which includes similar people. So the shared service coordinator, health directors, anyone who really knows a lot about the delivery of services in any of the member municipalities in your SSA, you may be involved in completing the service delivery tool. And in the service delivery tool, you'll indicate if your local public health entity delivers the service, if your shared service arrangement delivers the service, or if an external entity delivers the service, and then you're able to type in what the external partner is. And that's optional. You don't have to type in the external partner, but you are able to. And that's like a select all that applies. So it could be that all three of those work together to deliver the service, or just one of them does. Or maybe no one's delivering the service, and this is an opportunity to identify those opportunities to fill those gaps. Sorry, there's a message in the chat. I'm just gonna try to look at
Yeah,
that.
Ellie asked what the role of the collaborative was in this. I think after Kyla's done, we're gonna talk about like how to best do it. It's some towns it's gonna be easier than others. Do you know what I mean? But I think that we'll have to strategize, and I'll be providing Kyla a list of some suggested names, but like I could see for towns that want support, saying, hey, maybe we should sit down with your accountant person, you know, someone from town hall, the Board of Health chair, and then us for those towns that it makes sense. Otherwise, other towns I think will be okay, like Tri-Town and probably, you know, like Great Barrington and whatnot. There's more of a system. So, all right. Thank you. All right, Kyla, you're up.
Okay, awesome. I'll go to the next slide. So this is just, I won't spend too much time here because it's a little overwhelming, but this is just the timeline that we have to show folks of the overall shared services review timeline. So it'll kick off Tuesday with a webinar. And then there will be webinars also to introduce the service delivery tool and the cost tool in more detail. And then the data collection period spans through April. And then in May, there will be an SSA-wide meeting with me or another member from the BME strategies team to go through your results and talk about what this means for your shared service arrangement. And so this is my last slide, just next steps. Here are some details about upcoming webinars. Anyone who thinks they'll be involved in completing either of these tools is encouraged to attend any of the webinars listed here. They will all be recorded as well. So if you're unable to attend, we'll provide information on how to access those recordings. And if you have any questions, please feel free to reach out to me at any time, or your shared service coordinator, and she can direct any questions to me. That's all I have for the presentation. I know we're super limited on time, so if we don't have any more time for questions, that's okay, but up to you if anyone has any additional questions for me.
Well, I do want to have a conversation about this. So later on, we'll be talking about proposed meeting and training. And I tried to fit this into the schedule of like the off weeks, but we have to get septic systems done. And also housing is really heating up. And so my question is, if we can get people to this meeting that's next week, would that suffice for any training that needs to happen? Because I know that Kyla had asked to come back and do a larger presentation. Does that make sense for us? Is there time?
What time is that meeting?
It's
It's
afternoon.
3 to 4. Yeah.
Yeah,
all of
it's
these
during
are-
the
No,
special
these.
webinar time.
So we're talking about two things. These ones on the agenda are 9 to 10:30. It's our normally scheduled time.
Oh,
So Kyla had asked to come for how long of the actual training, Kyla, is it that you're meeting with other SSAs for?
It really depends on the SSA and that training. So if you go to these webinars or are able to watch the webinars, I think that would be sufficient to orient you to the tools. But I'd really love to be able to come back and answer any specific questions that you have once you've had the opportunity to look at the tools. So that can be on an as needed basis and not necessarily, like I could do it individually for each municipality if you think that would be better, like you were talking about, or I could come to another one of these meetings and just, if folks want to compile a list of questions and send them to me beforehand and I could share out, or I'm happy to do kind of more of like an office hours thing and have folks drop in if they have specific questions for me.
Okay. Do we want to just kind of convene and talk about it and individually, and then just decide and what would work for each municipality? Because we have such little time, I think, before we need to move on that. So, Well, thank you, Kyla. We really appreciate it. Is there any other questions for her? All right.
Kyle, I did have one question. I tried the QR code, and so will there be multiple people utilizing the tools? Like, for example, Tri-Town's the fiscal host, but we're still a separate entity, technically speaking. So I would be filling out Lee, Lennox, and Stockbridge information. And then obviously Jane will be supporting others, and like Rebecca would do her town. And so there'll be multiple people, right? Because each individual town has to do the reporting.
Yes, there will be multiple people, and so it's in SharePoint, so like multiple people can access the tool and update the tool at once, and you'll be able to see like live updates and everything as people make changes in them.
So the Board of Health, to Pat's point earlier, then if she's collaborating with the accountant or whoever fills out the tool, she might be able to have access so that she can see what was inputted and have conversation about that.
That's what she.
Yeah,
wanted.
absolutely.
Okay.
It's just important then that I have everyone needs access as email so that I can give them the appropriate access.
I'll reach out to all the towns next week and we can strategize on like who the right people are. Does that work?
Okay.
Awesome. Yeah, would you like me to stay on the meeting or? hop on?
No, I think we're good. Thank you.
Okay,
Thank you,
awesome.
though.
Thank you so much for having me.
Thank you.
Nice to meet you.
Thank you.
I'll put my email in the chat if anyone needs it, but then I'll hop
Oh,
on.
thank you. I got half of it. It moved too fast for me.
She is, Kyla was on the last email that I sent out yesterday. Her email is on there.
Okay.
So that's helpful,
All right.
but we'll make sure you guys have it.
Okay. Wow.
Yep.
Any thoughts on what just came across?
What?
Any thoughts?
Well, I mean, one thought I had is the training's next week, right, Jane?
Yeah.
The training for that, I think
14th,
we
I
should
think.
just maybe send out a quick blast reminding people that's a really important training. And then we gotta, I mean, do we want to try to, because I know we're meeting quarterly, do we want to try to reconvene next month and have Kyla come back? Or, I mean, those are just some ideas. I mean, my concern is we have a lot of rural towns that don't have a lot of town hall support, that so we need to figure that strategy out, how we can best support those towns.
Yeah. I think that I'll have more clarity next week when we reach out to the towns. Like I said, we have septic and housing is something that our boards have really wanted. And I feel like it's going to be hard to bump a septic training for data collection. So that's how I feel about it.
So
But
the meeting on the 10th is an in-person meeting?
the 14th, oh,
The
Yes,
10th.
important.
I'm looking
That's
at
that's
item
us
6.
right now.
That's us. Oh, sorry.
yeah, so the 10th,
Right. All right.
the fourth, and
I
so
thought it was
these
the
are,
14th and the 21st.
so
Not
yeah,
the
there's
slide.
two sets of meetings. This, I didn't even know about the 14th. So 1/14, January 14th next week is for foundational public health services.
Right, okay.
January 21st is foundational, January 21st is the same. And then the 28th. So there's all through the month of January, there's gonna be trainings.
And those are webinars.
Those are webinars. The ones that are on our agenda under 6, those are our either meetings or special topics.
Right.
So that,
Where are the ones you referring to, not under number 6?
oh, she had talked about them. They're not on the agenda.
Okay.
Yeah,
And you'll send out the URL for those things.
yeah. All right, we'll definitely be in touch, Kyla.
Okay.
Thank you.
It-
Bye.
Moving on, South County Resource Guide.
All right, Rania.
Morning.
All right, I am actually gonna make you co-host for a second so that you can share.
Okay, thank you.
You should be able to share at this point. While she's getting that up, so Rania has an organization that something very near and dear to her heart is called Families Like Ours, and I'll let her talk about what that is. but it's really exciting addition to our community. And so we actually contracted out with her to help us get traction on doing a printed resource guide. We have 413 Cares, which is an online platform, and that has certainly its purpose, but sometimes we just need something printed. And so this is what we worked with her to kind of come up with this. So this is the first time that it's kind of in public. We're going to be sitting down with the resource, the South County resource, hopefully for next Friday, to go over it with a bunch of people that provide resources in Berkshire County. And then hopefully it will be, by February, it's going to be distributed in the town halls, first responders.
Library would be a great place. We have a lot of people that come to the library all the time to look for stuff.
That's a great idea. So, and it will be nice, like, we're gonna have it kind of be like a thicker paper on the outside, and I feel like, and then people who want changes can ask for additions or changes, and then we'll have it on our website. So it will kind of be live on our website, but annually, the goal is to print it out. So, Ronnie.
Did the Rural Health Network also work on this, or just families like ours?
So the Rural Health Network, originally we were Tri-Town and Southern Berkshire had wanted to do this. They went more in the direction for 413 Cares. So, and we just decided we still wanted to do the printed. So, so yes, and a lot of the data that went into working for the Rural Health Network informed this work. Because I had hundreds of hours in on that before they decided to go to 413 Care. So yeah, good question. All right, I'm trying to get the view so that you guys can just see, but it's plenty big, huh? Okay. All right, Rania.
Sure. So, hi, I'm Rania. I have lived in the community for the last 35 years. And so a lot of the resources that we've listed are things that I have noticed through my work in the community are just consistently needed, no matter who you are, whether you're brand new to our area or you've lived here your whole life. Some of the programs that exist, our stakeholders don't even know about, right? Like our libraries to be able to refer, or even our police stations to be able to physically hand something to somebody and say, here, try these top 20 housing resources. So amongst talking, it's not always the easiest thing to navigate a website. So we thought it would be really helpful to have something on paper, a little booklet that we can either hand to someone, or if the option is to go online, it just works really well. So I did community work through community health programs for the last 12 years. I was in the school system before that. And through my years of experience, I also ended up having a son with autism and a rare genetic disorder. And so I started Families Like Ours after I realized the resources exist. I'm just not sure everybody knows how to find them. And so without reinventing the wheel, I created this community of parents who in the beginning were, 5 or 6 families. We'd meet at the park, we'd do an autism awareness walk. And we just kept getting more. What can we do as a group? And so it's been really fun creating an office space and then being able to offer 6 or 7 things. We're located in Great Barrington. We're called Families Like Ours because it's not just about parents who have a child on the spectrum, but with any disability. And we've created this little hub of parents who are now, I think we're hitting over 50 families now that reach out to us. We offer support groups. We offer outings together. If somebody says, gee, I really want to go to Nomkeg, or I really want to go to Tanglewood, but I don't want to ruin everybody else's experience. We respect the fact that other people have paid for these tickets or whatever. So we go to Tanglewood and we say, hey, how about a Families Like Ours day where our kids can overstimulate all they want, be as loud as they want. And we're doing it together in a safe place where there's no judgment. And so a lot of times what we face is, how can we help? So anyway, that's about Families Like Ours. We're excited. We just got nonprofit status in 2024. So we're excited to continue growing. This resource guide specifically is meant to help our community, right? We're helping our own by saying, here are the top 20 resources in housing, transportation, food, mental health, and special needs resources in case our community health workers are bombarded. And then they can take that next step to say, okay, I know what the resources are, but can you help me connect to them? But at least in front of them, they have these. So here's a sneak peek. We're about 98% done with this resource. You are the first group to see it live. Here's a beautiful picture of our area, just acknowledging who it's published by. There's a little letter in here telling everyone about our towns. And then the guide was, just reiterating, the guide was created to provide a printed resource, but also it's going to be on our websites. Our table of contents, which then goes into first emergency services, and then a list of our towns and their information, and then just in alphabetical order, what we've tried to provide. And then at the very end, we list a resource guides for people in the community that have created something similar or maybe more specific to someone's needs. So if somebody's looking for even more on special needs, we have a little list of like, okay, click here for the deaf and hard of hearing, click here if you want to learn more about the Southern Berkshire Public Health Collaborative. So we go into emergency services. We've listed out anything that we thought would be helpful in an emergency. So this specifically may be for the police stations, for the ambulance guides. If somebody's in crisis, they have that quick kind of phone number that they can call for help. And then we go into our towns. We've listed the Board of Health, fire departments, libraries, police departments, public health nurses, school districts, and then the town offices. We tried to provide the address, the phone number, and the website, or the specific email that you can contact with questions. We go through each town, which is really fun, because it's a very quick go-to.
And we did include Egremont in this because they're integral in our region. But even though they're not one of they're in part of South County. So the focus was on South County, not the Southern Berkshire Public Health.
I'm not the public health nurse for Egremont though. So
You
that
are
needs
not.
to be updated.
Okay, great.
I am now.
Come on, Jill.
Come on, Bill.
Okay.
Yeah, Rhonda, we want to make sure. Rhonda, and I haven't had time to get. Rhonda, I haven't had time to really dive deep with the move and stuff. I want to make sure that we have our Tri-Town co-responder that's in there for the three towns at some point. For for mental health and so on, whatever.
Okay. Perfect. This is why we have these. All eyes on deck. Cool. All right, then we shoot right into alphabetical order. Food resources. Again, there's really the top 20. You'll be able to see this if you want in a more guided, like slower setting. So we go from the food bank, Western Mass. We tried to do like a phone number, an address, an email, the websites, a focus. So we tried to list just a little blurb. We reached out to a lot of these places and they either created their own or we just threw something in from their websites that we've verified. So, right, like the Guthrie, this one right here, just they provide free community lunch held every Wednesday from 12 to 1. People can reach out for more information. We have everything from the HIP program that goes through SNAP to provide more local produce to what is PEBT, right? The state is still kind of sending out benefits for the schools. School lunch is still free, stuff like that. Senior programs, then we go into school district food programs in case we have parents looking at it. not everybody knows they can get extra food from the schools or any programs. Specifically, I know the Southern Berkshire Food Program in Sheffield has a village food program where the local church provides a box of food for any family that signs up for free. It can either be delivered or parents can pick up at the school. No questions asked, not income guidelines. It's just, if you need it, they will believe you and they will give it to you. We go into food pantries, and right, this has to be a living document because a lot changes throughout the year, and that's why we hope to keep it online. And anytime anybody emails us about changes, we are more than happy to make them online. And then in next year's guide, when we print them, they'll see it in the printed
So
book.
there is one in Lennox too. There is a food pantry in Lennox. I don't know if it's on there.
All right, well, I'm writing down all this stuff. Don't,
Okay.
Okay.
okay,
Okay.
yeah, I did.
So then, oh, go ahead.
No, go ahead.
Okay, so then we move into housing resources. We've listed a few different ways and the differences between some of the Section 8 vouchers. We made changes so that people knew, like Berkshire County Regional Housing is now called Upside 413. We know Berkshire Housing Development Corporation is now Hearthway. And so making sure that when people go looking for this, they know to look under these sections because the names have changed. And just like, I don't know if everybody knows, Pathway is being bought by Spectrum or something like that. So I think those changes are really important because if someone tries to Google the information and they get confused when something else comes up now. We did campgrounds, in case the homeless population is looking for an alternative method. We did the CHAMP application, which not everybody knows what that is, but basically the state came in and asked if you are looking to relocate, you can go in, you can fill this application online or on paper, and you can actually check off all the towns you're willing to relocate to affordable housing. And so this is a really good resource because if people are willing to move, you can check out any town, you can check off any town from Sheffield to Westfield. And anytime an apartment becomes available on the Section 8 list, then they'll call you and they'll say, do you want it or do you want to stay on the list? So, and then again, construct everything from the Elizabeth Freeman Center to anybody who offers. We have the RAF program, the Shopper's Guide, right? Anything that has to do with housing, the snowmass, if you already have a Section 8 voucher and you need to move, if you have a child, I think under the age of 15, the state will pay to relocate your whole family to a new district. So that's really helpful. And then at the bottom of every section, we've also put additional housing resources. So in this case, we wrote like, check out Berkshire Property Managers, Facebook, Zillow. So I think people find this also helpful, will find it helpful. And then mental health resources, we tried to do the same thing, listed out the place, the address, the phone number, the email, their website. In this section, we tried to add insurance is accepted and we kept it simple. It was either Medicaid, Medicare, or commercial, or in some cases, none. And so we didn't want to, waste people's time. So if they're looking for services through, Berkshire Art, they know that, okay, they take Medicaid, Berkshire Fallon, and that might be something they highlight or want to call. The Breen Center and everything they have to offer. If you see anything highlighted or in gray, it's because we're still waiting for either a response or we're finalizing things. So collaborative endeavors, private practices that might take Berkshire Fallon, mental health facilities that are brand new to our area, which I'm not sure if everybody's heard of the Commonwealth Collaborative, but they're pretty cool. DMH services. So if you have a young adult or even an adult that needs mental health resources and you've hit like a dead end with the Breen and mental health services and you just are at your wit's end, these are the people you call DMH. And again, you guys could, out of curiosity, read some of the focuses. It's kind of neat to read. Gold Farm, additional resources, helplines. So then we move right into special needs resources. So Padlib, Autism Connections, CATA, Charm Medical, who most people don't know, the state helps pay for pull-ups or diapers if you have a family member that's not potty trained after the age of 3. Which again, right, it's just a resource to us, but this is life-changing for a family. If you have a 5-year-old that isn't potty trained yet and you're spending $50 a week on diapers, this is a huge resource because the state now comes in and acknowledges your struggles, and now you're not paying $200 extra a month for diapers. The state is helping you pay for them, and they get delivered to your door, so you don't even have to go shopping, which is insane. The state offers, so the catastrophic illness fund, which is if you have an extremely sick child, Mass Health will actually let you apply for a catastrophic relief fund, which then helps you get reimbursed for your gas for traveling to like Boston Children's Hospital on a weekly basis. They pay for hotels, they pay for food. And again, you have to spend all this money, but they do a 2-year span, which is huge. Like what? DDS, sure you can't tell how excited I am. Of course, I'm in here, right? The Federation, Learning Solutions, palliative care, which is huge. Okay, so then we go right into transportation. We did call every one of these resources, made sure that they're still working. We tried to write like rates vary with what areas they go to, which Albany and Hudson and Springfield, like that doesn't sound like something families might need, but when they have doctor appointments here in the state can't pay for a PT1 form or can't get them, this is a great resource for them. Especially some people have the means to pay and don't qualify for Mass Health. This is also a great resource for them. What else? So we have information on how to even get a PT1 form. Some people still don't know what PT1 forms are. We added Soldier On for transportation for veterans. We go into the towns, so senior residents, we tried to put some information on how to find more information on if your town offers things. So we know like, I don't know, Sheffield, only because I live there, I kind of pick it out, right? Here's the government website to learn more information. Here's a copy of the flyer they do. Here's a number you can call. Here's an email you can send out. And then additional information. And then we jump right into additional resource guides. So here is a space that we've tried to list. If you have a specific idea in mind and you want to learn more about it, say legal resources wasn't one of our top 5 of resources to list. So we added like legal resources. Here's the link to Community Legal Action or Nonprofit of the Berkshires, Southern Berkshire Chamber of Commerce. Here you guys are. And then we just did a disclaimer to basically say, this is all information we've dug up. Accuracy of the information may change over time, but we're doing our best to keep up. So, does anybody have any questions so far?
No, it's phenomenal.
Applause.
That's phenomenal.
Thank you so much.
Using a lot of that for my community of practice. I got put together.
Great.
Thank you for doing this.
When do we think it'll go
Yeah.
live on this side?
So that's something that we can kind of talk about, right? We, as actually it's Deb Phillips says, don't let perfection be the enemy of good, right? So we want to get it out. This is the first time. This is, I mean, was sponsored in, by the collaborative and working with Rania. So let's talk about it. I think that there are still some tweaks. I don't know if we haven't sent it in email form to anyone because we don't want it. We want to make sure that people know it's a draft. Do you know what I mean? But it would be good to have like, maybe like a month of vetting. So, I don't know if it would make sense to send it to you guys as in draft form and have you look over your towns to see if anything could be added. And then, you know, like I said, the South County Resource, group through Deb Phillips would be a really other good place, to do like kind of a preview of it and, get feedback from those service providers. And then I think at that point, it just needs to go out. And then when we're like, oh, okay, we'll change that. I think that's fine, right?
Yeah, I do too.
Did Rebecca have a
That-
question?
That was my question, yeah, thank you, it's really great, I like that it'll be, a physical copy too, because I think online resources can be a barrier for some folks, so
Mm-hmm.
great that it's a hard copy. The one drawback of a hard copy, I think, is that when information changes, how do you update that? So will it also live online in a working document too?
Yes, it will be on our website and, also Ranya's website, and whoever else wants to put it on. But like the links, I think instead of like in the towns, for instance, you guys could put it on your website, but instead of having it be like a PDF on your website, it could be a click and it would go to either Ranya's or probably our website, so that as things change, it automatically updates from in the towns.
Right.
So,
This is wonderful.
It certainly is.
Incredible.
If I could add, just a couple minutes, because I know we're going against our time. So, I get a call 2 days ago from, one of the, board of selectmen in Lennox.
Mhm.
And we're struggling, there's a,
which one?
without getting into detail, there's a homeless person, you know, struggling to access services, and multiple people are involved trying to figure out ways to help this individual. And so I get called trying to figure out how to problem solve this. And this is exactly the resource guide that we need to put out to the chiefs of police, the select board members, our mental health co-responder, our boards of health, have a physical copy with us when we do housing inspections and everything else in between. So it's not a question, it's more of a statement on the importance of this. And we've taken this endeavor on years ago through Prevention Wellness Trust Fund and many other avenues on trying to, you know, inventory resources. It's a major lift. And so, like, I told that select board person, if she had this guide, she could have got right in there and said, okay, and give all this information out, or hand the guide off to somebody. And so, like, there is a role in place for this tool. And I want to just thank you and Jane and everyone else for putting it together. And I think there's a few more tweaks to work on, but I visualize this as hard copy. I visualize this as online, printed, however form people want to use. And at some point, I want to develop an app for inspectors.
That would be cool, yeah.
When they're in the middle of a housing inspection, there's a no heat, you know,
Mm.
something comes up with like with some type of algorithm or something. I will do that before I retire. I really envision an app for inspectors. So thank you.
One more thing.
We just need a coder, because if you remember correctly, we tried to do that, and I'm not a coder. But I'm glad to know that's on my 5-year plan, Jim, for that to happen.
Well, and I also want to add that in the coming years, if we find that we need to add another section, so right now we've addressed the top 5 things that we've identified the community needs, but let's hypothetically say that the community identifies that we need a section on legal aid, right? We can add that moving forward into next year's book, or as we have time.
And like, the veterans agent, or the South County veterans agent, I met in the grocery store in the aisle. We kept meeting in the aisle. So we had like a fragmented 5-section conversation. And, he really wants for there to be acknowledgement of, like, the first question we always should be asking is, are you a veteran? And he can handle it from there, right? So that's one area that we should definitely try to figure out when we're distributing this, that has to be one of the first questions is, are you a veteran? Because it just opens up so many resources for those men and women that have served our country, so. All right.
All right. Thank you
The
again.
sooner the better.
All right,
Yes,
yeah,
yes.
great job, Rania.
Thank you
Truly.
so much. All right, I'm gonna go.
Okay.
Have a great day, everyone.
You
Thanks,
too.
Thank
Anya.
you.
Wow. That's a lot of hard work that she put in.
Sure is.
That's fantastic.
What would you do without people like that?
So what do we do with suggestions? I mean, I couldn't see whether there's two, that I have in mind were on there.
So what if we sent it out to this group
Yep.
under draft? I'm actually gonna put draft right across the
Sure.
watermark. And maybe if everyone can just look at their town and get suggestions back as soon as possible.
Yeah,
Give us a timeline, what, within a week, 2 weeks?
I think by the end of this, it would be good to have them by the end of January.
Okay.
If we can do it by the end of this week, great, but like, it would be great to have for the end of January, the town's inputs on it, in there so that we can move forward. And we had originally thought about 250 copies, so that's essentially 20 per town at this point. I don't know if you guys, what you think about that as a
I
starting
think they'll
point.
go like hotcakes.
I do too.
Okay, because
Do you think each town, like, I mean, I could bring something in to Carrie Sullivan and ask her to print me out a few copies, which wouldn't be beyond her to do.
right. Well, anyone could print it. We had thought about maybe trying to do a smaller booklet, but, I think we would run into the size of font being different and
Mm.
formatting, so we just decided, at least for this first one, it was just gonna be like an 11 by 17 booklet with a stiff paper on either side, maybe
Okay.
like a green or something, so it kind of doesn't get lost in the shuffle. I think it's gonna be really nice.
Yeah, me too.
It's gonna be fantastic.
In terms of a small town like Mount Washington, I don't think we need 20 copies,
No,
you know? So
Oh,
they
we
can
will.
go to another town,
Mhm.
bigger town.
yeah. So yeah, I understand what you're saying, and maybe like we do that, and then how many copies do you need? But this could be, I mean, couldn't you see a police station if you had a police chief who really bought into this, they could print one up for every one of their cruisers, and we wouldn't
Yes.
necessarily have to do that.
Yes,
Ambulance, same type
Yes.
of thing.
Great, fire departments.
that would be the encouraged way to handle it.
Anyone know a
Okay.
coder out there, let me know.
Mm.
It also has to clearly state how to request additions.
Mhm.
Because that guy in the cruiser may know something, and
Yeah.
how does she know?
Mhm. I wonder if there could be a cover page, and then on the back of that, like, the whole page is like, this is what we have so far, so that you're looking at the table of contents and you're looking at the back of the cover page. It's like, if you have any additions, you can
Mm.
contact,
Right.
instead of having it be a disclaimer at the end.
Mm.
Yeah, so, all right.
Okay.
So you're gonna send that out.
I'll send that out today. Yeah.
Next one, HRSA grant.
So, yeah, Jennifer Kimball, which many of you may know, she handled our emergency management in South County and for a long time, and is now part of the vaccine program at the state. And so she reached out to Deb Phillips initially, and then Deb and I are working together to do there's a grant that they're applying for, and it's basically vaccine promotion, and it's part of, they picked, I think, 6 or 8 different regions, and South County was one of those regions.
Oh, okay.
And it's basically about vaccine promotion, and so it's not an incredible amount of money, but it's $20,000 a year. And so we've been brainstorming about the things that we could maybe propose to be part of the work plan of the grant, including things like the vaccine provider, we're a vaccine provider,
Mhm.
information on how to get the RSV, right? It can be used for transportation to like pay for someone to get transported to either our office or the pharmacy. There's all sorts of different things. And they wanted to know if we would be interested in being part of it. So, I
With that
said,
many moving parts, it sounds like you're gonna need somebody to administer it
and so there probably is gonna be, I mean, there's gonna be additional work and additional costs, although a lot of the stuff is stuff that Jill wanted to anyway, and the grant doesn't cover a lot of the stuff. So we have other resources. We're really lucky, but, you know, two things about those resources. One is we want to make sure that we're sustainable if this grant, because we're in the second year of the 5-year grant, and with a change of administration, we want to make sure that we are well placed, so that we have prioritized and continue services. And then the second thing is like, if we as a group decide that one of the priorities that we want to do for vaccine promotion is something that wouldn't be coverable by the grant, or it just would be nice to have those extra resources. So they're asking that they have a 0.25 full-time equivalent person that would be doing vaccine awareness. We kind of already have that built into Jill, but we also have per diem nurses. Denise is one of our per diems right now that she really is hungry for just.
And she
Yeah.
was a VNA nurse, so she's got
Mhm.
that background too.
Very nice.
And it might free up resources to maybe use Rania for other projects, because, I mean, Rania's a superstar, let's face it.
Yeah.
And she's doing all this family like hours as a nonprofit. She's not paying herself. She's doing it out of her passion.
Mhm.
And so it's only sustainable if she can
Continue.
get, you know, so we could help that if that's something that we came up across something. One of the things, for instance, talking about Rania, that she, you know, that I'd like to bring back to the board at some point is that, you know, emergency preparedness during the fire. We think that we had it bad. If you had a child with special needs, or that needed very structured, having a go bag and trying to figure out what's important, and a comfort bag, you know, there's lots of opportunities for us to really be reaching that like special community. So any things like this that we can add might free up other money to have community partnerships like that. So.
Jane, I don't want to interrupt because you're on a really awesome roll, but Mike asked if we can give him just a couple minutes because he's got to leave, and then we can go back to that.
I actually have
Okay.
I actually have a doctor's appointment in 3 minutes, and I
Sorry.
want to hit you guys first. The SAFE legislation, as you know, has passed. It's been signed into law. We've put together it's about 3 or 4 pages of text with about 20 pages of exhibits on what the effect of the new legislation is going to be on local boards of health and health departments across the state. As I'm speaking to you right now, I've just hit send on the email to every one of you with a copy of our guidance document so that you can have it. And the only other thing I wanted to mention is that we're doing our training on 4/26 at the Hotel Northampton this year. And hope to see as many board members as we can get at it. And I'm sorry, but I have to run, but call me if you have any questions after you read it. It's way shorter than it looks when you open it, because most of it is the new legislation itself. That's like 3/4 of it is the new legislation. I have the old legislation and the workforce standards as exhibits, but it runs you through what all of the new provisions are, including the FPHS that you just saw the presentation from BME on. That's part of the new law. So anyway, sorry to run. Nice
Thanks,
to talk.
Mike.
And that
Thank you for
booklet is
coming.
very exciting, by the way. That's super, super exciting thing to have. And we'll see you all. Bye-bye.
Thanks, Mike. Okay. So just so you guys know, we are having another CART assessment in fall. There's a group of people trying to push back on it. You can see from this other thing, and then combined with this, that you'll be interacting with me a lot, and we'll just do our best.
Yep.
And, you know, hashtag Boston, am I right? And then at the very end, you'll see, not towards the end of your packet, you'll see that there's a local workforce standards waivers request. And so I just wanted to make sure you guys had it. When the new SAFE 2.0 comes out, there's going to be requirements for inspectors, and like if you're a board member who wants to do an inspector, there's training that you have to do. And so, you know, one of the things through the summer will be to figure out what those things are and get you guys set up so that you can take the trainings. You know, like, for instance, Jason just is going into the housing training next week, right? And then, then that's phase 2, so, and then he will have to go out with, an inspector and get kind of like evaluated, and then he'll be a fully credentialed inspector. And that's the goal that we're trying to, do. Jordan is almost all the way through, we're all the way through with your food.
All the way through.
He's all the way through, so he's actually probably one of, very few in Berkshire County that's like gone through the whole thing according to the, what he needs to take and passing that. So congratulations,
for you.
Jordan.
Yeah.
That's great.
You do, so. We just gotta get them the reports and they'll submit the stuff to the state.
That's wonderful.
Great.
Congratulations. So the last thing is the proposed meeting trainings. This is a sneak peek for you guys. I'll put it into a nicer format, but, so today, obviously, like, it's happening. Next month, I would like to go through some suggested changes for septics, like, we're gonna talk about what exists currently, which like the BCBOHA, offer some forms, but then also, talk about, whether or not we want to do some draft regulations for towns to consider to make sure that installers and designers know what their role is, like, that they need to stake it out, right? Like, they should be staking out anyway, but if as a town, you're like, it's on our checklist now, you designer have to check it, stake it out, just making sure that it's installed correctly, all those issues that we've been running into, and then also talking about like a mechanism, basically, if we're having trouble with it, an installer, so that they're not just jumping from town to town to town, which is happening. So then in March, the housing training, just basically what our roles are in boards of health. We do have some forms that we've adopted, just trying to like educate, I think, more than anything, the boards of health on what their role are for housing inspections. And this would be open to everybody, like these trainings, I would send it to all the board members and try to have it be engaging. Then we have our quarterly meeting. I was thinking in May, we could start talking about our work plan again. And also looking at our intermunicipal agreement. We do have to update it from time to time. It would just be looking at it, making sure like what still is relevant. Do we need to add things as we've expanded services? Also, I'd like to talk about, like, I would like to be Southern Berkshire Health Collaborative, Southern Berkshire's resource for public health. Like something along those lines, like to try to figure out, just have people think about us as a public health resource. We've also talked our standard operating procedures. We've almost completely got them done. And that is actually something now that the state is finally saying, oh yeah, and we'd like for you to have those. So we're anyway, so I don't need to go through the whole thing, but I would like to finalize this at some point. Is there anything like that you guys see that you would like switched around?
Well, you don't have food on there. I mean, you've got septic, housing.
Is that something that you guys would like to add, the food?
I think in the same way of understanding what our role is, what our latitude is, what are the issues to be most aware of. I don't know, it just seems it's a chunk of our.
I understand what you're saying, and we could have it, I didn't want to have something in August because of the summer. And because the August is the only time that I ever go on vacation. But if we could if you wanted to, we could do a subcommittee for the work plan again. It's just I really want to make sure we're hearing from the boards and all the towns to know what it is that you guys need. And so I don't want to do that in a bubble. And then the IMA, we could have a working meeting on April, but it just feels like these meetings get so full, I'm not sure. So,
Maybe I'm the only one, maybe nobody else is worried about that, I don't know.
well, our work plan talks about septics and housing. I think maybe, maybe for the next work plan, we could have it be, food. Or we could do something outside of the schedule, because I think food is a really important thing, like the nonprofit food, which we've been spinning our wheels about. Maybe we could have a training outside of the schedule.
There's space in December. You could, it says to be determined. Do you have something in mind for December or?
No,
Maybe food, or we'd have to wait another year, but.
Well, that would put it closer to the next work plan as well.
okay, let's put food there, and then maybe, that's great. And then in November, it's just too hard in clinic season.
Oh, yeah,
Yeah.
oh, yeah.
All right. Member updates.
I need 30 seconds real quick, 'cause I know we're way back beyond our time. Point one is I think it's really important to understand the legislation that was just passed. You know, when we first started PHE, it was like everyone's trying to do a better job in public health. This is now becoming law. And I think communities that aren't sharing or part of PHE, they're going to be left on an island to figure out how they're going to have staff meet compliance with salaries and everything else. That's where I think the benefits of sharing is a really good idea. But for example, I didn't know about this BME thing being in state law now. So, and I know when we did the CART the first time, there were challenges, right? It took us a while to help towns figure it out. But it's important that whoever's filling this stuff out, it's a requirement. And I'm not a fan of unfunded mandates and stuff, but like, this is how we got to this point with this legislation. Point two, the IMA, I think, Jane, if I'm not mistaken, does expire in 2025. So I think at some point we're going to have to look at that. And, you know, do we want to expand the IMA beyond PHE contracts more long-term? So we're not doing this every couple of years. And my third point is, I am going to be convening, I'm going to be leading and convening like a small group of people to look at some of the septic issues that we're having in some of these towns. I know Butch Kallstrom had reached out to me wanting to have a conversation. So if anyone's interested in being part of that conversation, we're going to be looking at some things such as the BCBOHA certification and the pros and cons of that, the challenges with installers, how do we get a handle on installers, engineer responsibilities. We're going to have a little bit of a brainstorming session on that. So reach out to me directly if you want to be part of that conversation. Thank you.
Do you want to just have that be in the February 14th?
Yeah, how is that different?
Which is the second February and the second Friday in February. It's already scheduled.
All right.
Maybe we
Yeah.
could just do it that.
Yeah, perfect. Yeah. Sorry.
All right.
We forgot the shared health agent update.
Oh,
Sorry,
Do we have
think I'm
time?
not speaking.
Wow. So, yeah, actually, I was thinking this morning, this is actually my fourth quarterly meeting. I know we're low on time, so I won't turn this into a whole year review, but, yeah, we have a lot of housing issues going on, that have, taken up a large part of our time. I really want to thank Jordan for coming on and helping us with food service. It's, really has brought a big value and degree of expertise to the towns that we're really trying to continue with. And as more issues come and as the housing guide develops, we're just preparing to offer the towns as much help as we can as from the collaborative. So that's just my update. So
Thank you.
And let me just say that working with Jason has been terrific,
Thank you.
very helpful. Just thank you very much.
He's a nice guy.
Yeah, he's a
He's a nice guy. Easy to work with.
Right.
very loud.
He's very quiet.
Anybody else have anything they want to add before we adjourn?
It's, I mean, this organization in public health is generally about putting out fires. But there's also an underlying aspect about public health that comes from things like glyphosate and things like that. And I think when I look at the woman who was giving us the categories, environmental was one of those categories. And I think it's important for us to have a look at what systemic change needs to happen, because the underlying health issues for most people are dietary. And what's being put into the soil is huge in terms of people's health. So I just hope that we can spend a little bit of time on that at some point. I know Mount Washington is going to try to pass a bylaw to regulate glyphosate with the state. So
I think part of that is finding partners, in the ag area, in the manufacturing area.
manufacturing is extremely difficult because they are a lobby.
Yeah, but I don't want us to be a silo. I somehow we need to integrate and communicate across
Yeah.
lines.
Yeah, it's a big, difficult issue. And the next 4 years is gonna be walking away from environmental nationally, so.
Not necessarily.
I move, we adjourn.
I second it.
Okay. Nice talking to everybody.
Happy New Year, everybody.
Stay healthy.
Bye.